Hello everyone, Namaskar. Greetings from HSR Dental Clinic and Implant Center, and welcome to Dental Podcast with Professor Dr. Deepak Daryani. I am Professor Dr. Deepak Daryani, and today we are going to speak about dental implants, and we will try to cover the common inquiries, questions which are there related to us. At HSR Dental Clinic, we have the Department of Implantology, where there are 4 specialists: myself, Dr. Rupanjan, who's a periodontist, Dr. Bipin Reddy, who's a maxillofacial surgeon, and Dr. Anoop, who is a prosthodontist and PhD in implant. So today, along with me, we have Dr. Rupanjan Roy, and he will be the host today, and he will be asking the questions. Dr. Rupanjan.
Hello everyone, welcome. Thank you so much, sir, for this opportunity to host this wonderful session ahead. Just a brief introduction. Myself, Dr. Rupanjan Roy. I did my master's in implants and perio from the Department of Periodontology, Manipal College of Dental Sciences, Manipal. So, sir, can you please let us know in very brief what are dental implants and when a person is in need of dental implants?
So let's go back in the history. Long time back, there were no dental implants, and when a person used to remove the tooth was replaced by putting bridges.
Okay.
So we used to cut the front tooth, which was good, and the behind tooth, which was good, and give a bridge on that. Now, what was the disadvantage? We were removing the enamel and dentine of a normal tooth. To replace a tooth which is already gone, we used to sacrifice the other 2 normal tooth structure, which was not a good idea, right? And eventually, if the patient is not able to maintain the oral hygiene, the cavities will form, it will go for root canal. We are ultimately killing the tooth.
Yes.
To overcome this, dental implants were discovered. And it is there in dentistry for more than 50 years now, if we go back in time. But in India, it has become very common from past 10 years, I'll say 10 to 15 years. Now, what is a dental implant? Dental implant is basically a titanium implant, because titanium is a very biocompatible material. So what do you mean by biocompatibility? So biocompatibility is a property of material by which it is tolerant to the tissues or the normal human tissues, and human tissue doesn't react with it. So titanium has got one of the highest biocompatibility.
Okay.
Usually these implant rods are put in the bone also to stabilize the bone whenever there are fractures.
Okay.
So what we did is, to talk in layman's term, dental implants are like the titanium implants, titanium screws, you can say, which are screwed inside the bone. And once it gets osseointegrated, that means the bone adapts it, we can load it, and it can almost completely replace a tooth structure. So basically, dental implants are for replacing a missing tooth without harming the front and the behind tooth.
Okay, sir. So that was quite interesting for everyone to know about dental implants. What I would like to ask you at this point of time is, are there any basic investigations or basic tests or diagnosis which a patient needs to do before he can actually go ahead and place an implant, or arbitrarily he can go ahead and place an implants?
Yes, it's a very good and important question. Now, dental implant is a surgical process.
Yes.
So we create a wound in the bone. There is a lot of bleeding which takes place. Not lots, but some amount of bleeding.
Okay.
Now, if a patient is there who is a heart patient and who's taking blood thinners.
Okay.
Or there is a medical compromised patient who is having bleeding disorders. Okay. So we have to be extremely careful when we are putting these implants because there can be bleeding. If a patient is there with uncontrolled diabetes, so we know that healing is delayed in diabetes because of various systemic factors.
Yes.
So we have to be extra careful in these kind of patients. So a lot of blood investigation needs to be done before placing an implant, which rules out systemic disorders related to blood and certain other systemic diseases, systemic infections, and also if there are any bleeding disorders, I'll say. Apart from that, implant is placed in the bone. So there should be enough bone present to place an implant. So the other investigation is radiological. For example, if you are putting the implant in the lower jaw, which is called as mandible, so there is an inferior alar nerve which is going. So we have to be very careful to keep a safety zone when we are putting the implant. So we need to take a three-dimensional, I'll be very specific. Earlier we used to do with 2D like OPG and all that orthopentagram, but now we have cone beam computed tomography, and we should always take a use of this technique because we can see the bone in 3 dimension. Okay. We can almost exactly know where are the normal surrounding vital important anatomical structure so that we don't harm them when we are placing the implant.
Okay. Okay. So one more thing pops in my mind, that is, can everyone go ahead and place an implant, or there are any particular candidates where implant is contraindicated, or what I mean is where we cannot place an implant even if the patient wants it? Are there any factors like that?
There are various factors. There are various circumstances when implant cannot be placed. The common ones, let's say, are when there is not enough bone. For example, if you are putting in a very elderly person and the bone thickness is very less, so you have to put minimum width of implant, otherwise when you load the implant it will fail. Yes. So we need certain length of implant, okay, otherwise it may fracture or it may not stay there itself and it will come out. So there are implant failures. Yes. So the primary factor here is how's the bone quality and the quantity. Okay. The second thing will be the various systemic diseases which a person may have, which include certain systemic infections, certain diseases like uncontrolled diabetes, conditions like post-radiotherapy. So there are various like these things wherein we may not be able to place implant, including the bleeding disorders.
Okay. Once you told about all these factors, now once we go ahead and place an implant, what are the common problems or what are the common complications which we can anticipate while we place an implant, or what are the common complications which may arise during placing an implant and how to tackle them, if you can just throw light on those factors?
So again, a very important question. What I personally feel that if your preparation is optimum, if you have prepared well for implant placement, then you will encounter less issues. Okay. So what are these things? Number one, you have a CBCT with you so that you know exactly how much bone height and bone width is there. Okay. If the bone height is less, then we may have to take actions like we form more bone there with the help of bone augmentation and all that. If, for example, you are putting it in the upper jaw where the sinus is low, there's very less bones, and then it's better do sinus lift procedures and then place an implant. Okay. Just placing an implant may perforate the sinus or the implant itself may fail. Okay. It's absolutely important during the implant placement that the sterilization protocol is 100% optimum, so that the chances of infections and hence the failure during the implant or after the implant placement is reduced. It is very important to have a very high quality implant system with very precise drilling instruments, okay, so that we can place a perfect implant. It's also very important that the dentist ensures that he has an implant system wherein if we need some different kind of post-operative materials or instrument or components, they are easily available. Otherwise, during the later prosthetic phase, there will be a lot of time wasted in procuring that. Apart from this, I will say that post-operatively, a lot of care has to be taken by the patient. For example, if you have not taken a good history and the patient is smoking, we know that the implant failure rate is very high in the people who smoke. So there are a lot of patient related factors. One of the most common reason for the implant to fail is improper oral hygiene maintenance. So if the patient is not taught to how to maintain, so if he is not able to maintain the food lodgement, those can lead to peri-implantitis, that is inflammation of the surrounding tissues, and hence the failure. And when we talk about peri-implantitis, which is related to periodontium, that is the structure which holds the tooth, I would like to actually request you to give the knowledge regarding the role of periodontium, how important it is to maintain a good bone and the gum and the oral hygiene level for the implant. Can you put some light on that, Dr. Rupanjan?
So that's a very important aspect which everyone should understand before we go ahead and place an implant. So as you told about in the initial questions, that implant is placed in the bone. So a periodontium, or the specialty which I deal with, just focuses on the supporting structures which holds the tooth, and for this matter an implant. Now when the hold factor is not good enough, then nothing can stay for a long period of time. Now coming here, we have to respect the biology of the tissues which hold the implant. Now when I talk about the tissues which hold the implant, there are principally two tissues which holds an implant. First and foremost important tissue is the bone, which holds the implant and gives its maximum strength. And second is the peri-implant tissues, that means the gum lining which covers the bone holding an implant. So that particular tissue is called as an peri-implant tissues. Now when we want to understand about implant failures, or for what reason an implant can fail, it's in a situation when either these tissues are in a problematic situation. Now it can happen that the surrounding structures gets inflamed. Now when the surrounding structures gets inflamed, the microbial load of those structures keeps increasing at a drastic rate. Now when the microbial load increases, what happens is the term, as you mentioned, peri-implantitis, that means inflammation of the tissues surrounding an implant. Now when these inflammation is restricted at an early stage, we can maintain a very good life of an implant. But if these are not maintained at a very early stage, as in not maintained, what I mean is improper oral hygiene maintenance, uncontrolled systemic disorders, or for that matter smoking. Now all these three factors contribute to a drastic increase in the microbial load in the periodontal tissues or the peri-implant tissues, which leads to a loss of the supporting bone. Now how we understand that the supporting bone is getting lost? Now when you see an implant structure, there are various thread-like markings on the implants. Now slowly what happens, once the implant is placed, ideally no threads should be exposed in the oral cavity. That means we shouldn't be able to see any threads. Now when these microbial load increases, they start eating away the bone. Once the bone is eaten up, the threads of the implants keep exposing one after the other. Now what we say is that over a long period of time, every year, there is some amount of bone loss which is normal in an implant. That is not pathological, that is physiological, which is only 0.1 mm. The moment we see that this rate keeps increasing significantly over a period of time, we say that it is suffering from either peri-implantitis, or the surrounding bone is in a state where it can't support the implant for a long period. Now at this time, we should address the factor to sustain the implant for a much more longer period of time.
Also, I would like to put one more point here, that implant placement in the bone should always be prosthetically driven. So we have to determine beforehand, as I said, the preparation for implant placement is very important. we have to determine where the final crown is going to come, and as per that the implant should be placed. It's not that the implant is placed first and then we determine later how the crown is going to put. That can lead to abnormal load to a implant, the prosthetic load when the patient starts chewing, which can be one of the major causes for implant failure, along with the poor oral hygiene maintenance.
One thing now as we spoke a lot about implants and what are the complications, what I feel is a very common thing which will pop in the mind of the listeners is, what is the average life expectancy of an implant? Or once I place the implant, till how long I can expect the implant to stay healthy in the oral cavity?
A very, very important question, because you are paying and you are putting so much of time, money and energy for placing an implant. The process takes more time, most of the times, and involves some more amount of money and energy. How long it lasts? Well, how long it lasts depends mostly on the patient related factors. Those are very important factors. Okay, of course there are many other factors from the dental as perspective, but if the preparation is very good, the bone height width has been determined, we have done we have made sure that the implant is placed in enough quality and quantity of bone, then the chances of implant failure becomes very low, procedure wise. Okay. However, after the implant placement, if the implant is placed right, it's prosthetically driven, placed in an infection controlled environment, a good implant is placed. So in all those cases, the chances of failure is totally depending upon the patient related factor, which includes habits like smoking, most important, because smoking increases the temperature of the oral cavity, which can lead to immediate failures of implant, and other oral hygiene maintenance related factors. So I tell the patients that it is going to be lifelong if you maintain it well. However, there are implant failures and there can be multiple reasons, which may also involve the other systemic reasons, systemic conditions wherein the implant can fail, like uncontrolled diabetes and all that.
As we discussed a lot about implant failures, so let's take an example. We have maintained all the precautions while we place an implant, and still an implant fails because of whatsoever reasons. Now, if a patient walks into our office with a complaint that an implant has failed, or it has come out, or it is moving, then what can be done from our side? Should we take out that implant, or should we do some bone grafting to stabilize that implant, or what we can do from our side to help the patient?
This is also a condition which is seen, and the most common reason for this is improper oral hygiene maintenance. Okay, then we assess a lot of factors. How is the systemic health of the patient?
Okay,
if the systemic health is good, if the patient is cognitively good enough to maintain the oral hygiene, then seeing how much is the mobility, how much is the bone left, we can think about doing the bone grafting procedures, and again maintaining the periodontium. And about maintaining the periodontium, using the bone graft, sterilizing the process, I think you can put a light much better as you belong to that field. So you can just put a light on that, and then we will also talk about in the condition when we can't save it at all and we have to sacrifice the implant, and probably if the patient is willing, we go ahead with the bone grafting procedures and place a new implant after some time. So please, from your point of view, talk about a condition wherein the patient is not very systemically compromised. He is able to understand and will be able to maintain the oral hygiene and is willing to save that implant.
Yes.
What all things we can do here to save them?
When we go ahead and try to save an implant, the first and foremost thing which comes is the implant maintenance after the implant was placed. Now, when we talk about an implant maintenance, and side by side we go ahead and talk about maintenance of natural teeth. Now, when we maintain a natural teeth, we do scaling, that is the routine professional cleanup, which is to be scheduled every 6 months. Now, here what we use a metallic instruments to remove the deposits which form around the tooth. Now, one very significant criteria is that we can't use a metallic instruments while we are maintaining implants, because implant is a titanium surface and there can be chemical reactions with the other metals used. So one very important thing is a plastic instrument should always be used to clean the surface of the implants, or which we call it as the debridement of the implant surface, and that needs to be maintained accordingly. That is the first step. Now second is how we can save it once it is mobility depends upon. Now when we talk about the saving, that depends again on the grades of the mobility, how much the mobile is the implant. Now when we say grades of mobility, grade 1, 2 and 3 we rate, 3 being the worst case and 1 being the initial starting stage. Now as per my knowledge and my awareness, what we can do is 1 and 2 we can try and save it. 1 and 2 is in a situation where 3 to 4 threads of the implants are exposed, not more than that. In such a scenario, what we can do is we can raise the flap completely. Flap is the tissues holding the implant. Raising it completely, debriding the surface, that means removing all the granulation tissues or the infected tissues which was the reason of the bone loss. Debride the surface completely. Now here also we can use lasers to debride and decontaminate the implant surface. Now once the implant surface is decontaminated, again one important thing I want to focus is with plastic instruments, not with metallic instruments. We can augment the bone which we have lost using artificial bone substitutes. Now these artificial bone substitutes, the intake rate depends again on the systemic condition of the patient, which we have to do a thorough review before we start off with the procedure. And after we do the bone augmentation, there are some precautions which we need to tell the patients. And in like this, we can try and save an implant from getting lost completely. However, after we do a bone augmentation, also a periodic checkup and a periodic maintenance every 3 to 4 months is what I suggest all my patients, that we have to keep checking the mobility of the implant, that it should be coming down from 2 to 1 or from 1 to no mobility. That should be the scenario. But however, if it's a grade 3 implant mobility with more than 4 threads exposed, in such a situation, the peri-implant inflammation has progressed to a stage where it is to some extent irreversible. We can't try to reverse it. So in such a situation, it's always better to take the implant out, do a bone augmentation in the implant socket, wait for a few months for the bone to form, and then we can go ahead and place a fresh implant once the bone has formed in a complete manner. So that's what we can do from our side when the implant is either moving or it is in a stage where it is affected by peri-implant. And one last question, sir, I would like to ask is, what is the charge of a dental implant? Because that is something in the Indian population, we think the charge first. So if I have to plan an implant, what should be in my mind? How much is the cost factor for the implant as well as for the crown part of it? And what is the duration? I mean, if I get an implant phase today, should I get the crown today itself, or how is the crown factor that phased? And please enlighten us regarding the cost factor it is.
Again, a very, very common, interesting question. Let me talk first about the later part, that is loading the implant. So I personally believe that we should not be in a hurry and try to load the implant immediately, because see, the implant foundation is formed by osseointegration. What is osseointegration? Once we place the implant, the osteocytes, that the cells of the bone, they adapt in the screws of the implant, and it adapts, it recognizes the implant as self, and osseointegration takes place. Once the osseointegration takes place, the implant is ready to take the load. In many situations, osseointegration doesn't take place, especially if patient is smoking and all that, in which case after 2 months or 3 months the implant will be mobile, and that suggests that implant has failed. So there are many schools of thoughts here, and in many situations, especially in the anterior teeth, we cannot leave the patient without the implant. A temporary crown is placed immediately in the implant, which is called as immediate loading, which is done. But if it's a single tooth case and not a full mouth, my suggestion will be to always go for alternative prosthetic procedures like putting a denture or putting a Maryland bridge and give it instead of placing doing an immediate loading of the implant, because that can lead to implant failures. My suggestion will be to wait at least 2.5 to 3 months and then load the implant. What will be your idea, doctor? Would you like to put any more comments here?
As you said, it's very rightly that I being a periodontist would also not like to load the implant immediately, because osseointegration is something which is affected with immediate loading. The moment the load falls on the implant, the complete pressure goes into the bone, which hampers the osteocytes from coming and binding with the implants. That is a very important thing, which I would also like the same thing, that to be given a certain time period for the proper osseointegration to happen and then the implant to be loaded. One last thing I would like to add over here, as you said about the anteriors, where aesthetics is one very important factor, where the patient would not like to have a dull smile, where the crown is not given. As you said that yes, we can go ahead and do a temporary crown for immediate loading so that the aesthetics is not compromised. Also these days there are concepts of the Essex retainers with a laminate crowns on the top. In such a scenario, the retainers can be completely worn with a laminate crown where the implant is not loaded. The implant is completely free of the load, but we can give the patient that option also with the crown, so that the patient is also happy, aesthetics not been compromised. Second, the implant is also happy that it is not burdened with too much of load immediately. Let's give the time for the implant to stabilize, and once stabilized, we go ahead with crown, we'll remove the Essex retainers. That is also one more thing I would like to say.
That is what the point I wanted to say. And in the benefit of patients who don't understand what is an Essex retainer and all that. So when we have put an implant and it's within the bone, we have an empty space, especially in the front region. So how will you go and communicate? How will you smile? There will be no tooth. So we have to replace it. So instead of immediately loading the implant and risking the implant failure, there are other prosthetic methods for giving a temporary tooth without loading the implant. So that can be in the form of a denture, or it can be in the form of acrylic bridges with wings which we attach to the adjacent tooth, or as Dr. Rupanjan said, it can be in the form of Essex retainer. These are retainers which take support of the other tooth. They are transparent except in the area where the tooth is missing. So that is colored so that you cannot make out that there is no teeth over there, and you can manage with this for 3 to 4 months or even more if required. If, for example, if you have done a bone grafting and placed an implant, we may need to wait for up to 6 months. So you can keep wearing this, and after 6 months, once the osseointegration has firmly taken place, you can go ahead and replace the tooth. You can load the implant and place the final restoration or final crown on the implant. Thank you so much, doctor, for your support. And so I would like to talk about this podcast, that it's an effort from HSR Dental Clinic and Implant Center to educate the general public about the common dental procedures and try to give them information which is current, updated, evidence-based, and as genuine as possible. We would love to have your feedbacks. Please give your feedback to us. Tell us, how did you feel? Did you get the information right? Were you able to understand, or the things became too technical? Actually, we did not cover all the points. We just tried to make it as simple as possible. But still, if it feels like it is not, not very simple, and you want to know more about it, our contacts are here in this podcast itself. You can see it on the screen. Please feel free to contact us, and our front desk will connect you to one of the specialists, and they can ask your queries, or for that matter, about any dental procedures which can be done in a dental setup. We would like to help you as much as possible. So thank you all so much, and we wish you all the best, and please keep coming back and give your valuable feedback. Thank you so much. Namaskar.